It's a taboo topic, but it shouldn't be. I mean, sex in general is a taboo topic, which really is a shame.
The new movie, The Sessions, about sex surrogates, isn't something to raise your eyebrows at. The main character with an extreme disability enlists the help of a sex surrogate to teach him how to overcome his limitations and perform sexually. A therapy doctors say can benefit lots of people in South Florida.
They're professional and successful in every other capacity of their life, but they've never hugged anyone intimately, or they've never been massaged without all of their clothes on, or walked down the street holding someone's hand.
Therapists say a session with a sex surrogate could be a lesson in anything from how to go on a date and be romantic, to how to touch someone, to how to look at someone, and
it does go all the way to full sexual intercourse.
In other cases here in South Florida, it's not about sexual function at all. For example, a doctor seeking surrogate therapy here in South Florida used it to kickstart his emotional function.
What he was seeking was something from the neck down and waist up. He was looking for that kind of intimacy. Now, when a person wants that, that is a very important part of a surrogate program. This is not the type of person who goes, kind of bored. I think I want to bump it up with something like, ooh, how about those surrogates? This is not this type of program.
For example, surrogate therapy is helping autistic adults, wounded warriors coming home from Afghanistan and Iraq, people with extreme physical disabilities, and people with problems that are all in their head.
Or have terrible performance anxiety, or have had terrible experience or no experience.
People who have transitioned from one sex to another, they've undergone gender reassignment, they may use a surrogate to be comfortable now having sex in their new body.
And the way that they can overcome it is certain things by themselves, and then they have to practice with somebody.
I know 3 who are here locally who really help people learn how to improve their their capacity to have intimate, sexually satisfying relationships. They're very, very caring, and they're not at all sort of perverted.
You were a surrogate 20 years ago.
36 years ago.
Before you were married.
Right, 36 years ago. It was amazing.
The treatment is controversial. Dr. Marilyn Volker tells me it's not always covered by insurance and not widely endorsed.
Did you have to engage in sexual teaching?
When I was a surrogate?
When you were a surrogate?
Yes, with some patients, not all.
Some therapists are willing to work with surrogates, some aren't, but there's no concrete numbers or research done in it for the fear that if everyone knows about it, then law enforcement may become involved, and then it may become legally banned.
So what is a session with a sexual surrogate like? Well, contrary to what you might think, doctors say surrogacy sessions don't start in the bedroom.
And the way that I was trained is you meet with the counselor who's going to supervise. The counselor, the patient, and the surrogate.
Once a plan is in place, the surrogate and the patient will head off at their own to work at their own speed and comfort level to achieve those goals, whatever they may be.
Either the client or the surrogate would come to a point where it's successful.
Are these dates?
Sometimes. It could be going out to dinner and learning how to flirt with a partner. Oftentimes it's going to someone's place of residence and being sexually intimate with someone, even without the sex. There's many other activities that are involved in a successful, intimate relationship, and surrogates practice all of those, the wide range of them.
The sex therapists we talk to say the bottom line is this: have more intimacy, have more happiness.
More satisfied people in the bedroom, less STDs, less divorces, and of course, happier people, and that's what we want.
But what this program taught me, and now a surrogate can help to teach, there is a lot more about sexuality than just between the legs.